Welcome to this episode of Look Around Lubbock, brought to you by Fox 34. Hi, I'm Kurt Kaiser, and I'll be your Look Around Lubbock host over the next several months as we explore the medical community in Lubbock and the surrounding area. Lubbock is the medical hub for the citizens of West Texas and eastern New Mexico. The Lubbock area medical community offers the highest quality advanced health care in the region. Medical providers strive to provide services that encourage healthy living and address serious healthcare concerns. Look Around Lubbock will inform viewers about many of the exceptional medical services that are available in the Lubbock area. I hope you'll join me every weekend right here on Fox 34 News Now to learn about many of the healthcare services available to the people of West Texas and eastern New Mexico. Your healthy lifestyle begins with education about the excellent medical services available to promote exceptional healthy living. In the state of Texas, over 35% of adults are classified obese by the CDC. That figure is among the highest in the country. Texas Tech physicians and their partner hospitals, University Medical Center and Covenant Medical Center, are working to change that through bariatric surgery.
Bariatric surgery has grown like any other branch over the last 30-40 years. Initially, in 60s and 70s, the surgery was done open with big incisions, which was a problem in somebody who's already obese, and the recovery was not as smooth. Over the years, with the advent of laparoscopic surgery, minimally invasive surgery, things have gotten much smoother, recovery is much quicker, and so overall bariatric surgery has become much safer.
There's a lot of song and dance around weight loss, and they may have never heard the term morbidly obese before. And so I have to sit down and kind of figure out where they're at in this whole process and if they've kind of wrapped their mind around having a weight problem.
Mandy Moore's expertise is medical weight loss.
Many physicians and many of our surgeons refer patients to me who need to lose weight so that they can have either an orthopedic surgery or have a hernia repaired. They're just too big for something that's coming up in their future, and so that's where I come in.
Whether weight loss is through bariatric surgery or not, both Dr. Goyle and Mandy Moore agree it's a lifestyle change.
You have to combine the surgery with lifestyle changes to get the long-term benefit, and that's another misconception that people often come with, thinking that they'll have the surgery and then they can go and do whatever they were doing before.
I always tell people you didn't put the weight on overnight, and so you're not going to get the weight off overnight. And to be successful, I tell my patients this is not a diet. This is a lifestyle that hopefully you carry on for the rest of your life. We start with baby steps that kind of snowball, and before you know it, they've lost 50 or 75 pounds, and their family's losing weight at the same time because they're also making changes.
The sodas are one of the biggest enemies of weight loss because they have pure calories, no nutritional values, and on top of that, if you have had a bariatric surgery where the size of the stomach is reduced, then the carbonation, the release of gases can cause reflux and other problems. So from both aspects, it's not a good idea to be on sodas and carbonated drinks after this surgery.
Sweet tea and Cokes are huge in West Texas. And so I kind of have to figure out what's going on at home. Are there little kids that are picky eaters? Is money an issue? Because unfortunately, healthy food a lot of times is not always, cost effective.
Patients who have personal motivation to lose weight have the best success rate.
They have a personal connection or a family based connection and they are invested in that and not just reaching a number or looking good, then we see the results. Obviously, they are much better when people are invested personally and they are looking out for their family members and want to do this for their family. When the patients come back with their stories like their pant size is reduced. They could shop in regular clothing stores instead of having to go to special big size clothing stores. They can sit with their grandkids in for example, a Six Flag ride, or they could bend down and tie their own shoes. All part when you hear those stories that yes, I'm doing something that is changing lives.
I see that weight loss surgery is changing people's lives. We're taking them off of all of their medications. They're running and playing with their kids and grandkids, and they've never done that before. That's such a good feeling.
The month of July was National Cleft and Craniofacial Awareness and Prevention Month.
In the United States, there are about 8,000 babies every year that are born with an orofacial cleft. But if you start thinking worldwide, a country like India, China, 20,000 babies a year. And so over 100,000 babies every year are born with a new diagnosis of cleft lip and or cleft palate.
This is just one aspect of Dr. Demke's work as a facial plastic surgeon. Interest in his field started for him as a medical student.
I was really inspired by seeing those kids' lives changed from being born with something that can affect your self-image and your confidence and can be devastating to a parent, and being able to affect change and really early on it's kind of changing the lives of the parents, and then of course as the kids get older then they start to affects their own self-confidence as well.
Dr. Demke is a busy man working at Texas Tech University Health Sciences Center, not only as a surgeon, but as professor, training students in his field of expertise. Not only does he work in Lubbock, but on a regular basis works with organizations like Cupcakes for Clefts, Interplast South, and Smile Train, who do work in this area and overseas to change lives.
I've been to Honduras, I've been to the Philippines, I've been to the West Bank, and I always come away feeling like I was more blessed than anything that I did. And that's a good thing, I think, as in life, that we look for ways to be of service and to give back to our communities. But I find that usually anytime I do those things, I realize that I didn't really make a huge difference in the world, but it made a big difference in my life. I see kids on mission trips that are 8, 10, 12 years old and never had a cleft lip repaired, right? And that's, you just think about as you get older and becoming aware of that because people point it out to you or maybe tease you about that, how difficult that would be in early childhood to be shunned or to maybe be culturally not as accepted by your peers. And that's sad to me, but it's also really exciting to just make that difference.
Technology allows for early diagnosis of a problem.
A lot of times a three-dimensional ultrasound or 3D ultrasound will pick up the diagnosis of a cleft lip prenatally. And so frequently I get referred moms, expectant moms who are somewhere in their second trimester or third trimester who have a new diagnosis or a known diagnosis of a baby with a cleft, and yet they've not yet delivered. And they come to me with alone or with family members to talk about, okay, what can I expect?
Plastic surgery can be divided into two main categories: reconstructive surgery and cosmetic surgery.
I don't have anything against cosmetic or aesthetic surgery, and I certainly do my share of that on the face. I don't do any comprehensive body plastic surgery. It's more rewarding to me personally to have somebody like whose ears stick out and they're bullied at school, and to be able to just make them feel more confident, or to be able to wear their hair up. That's something that I really enjoy.
The Ear, Nose, and Throat Department at Texas Tech University Health Sciences Center, changing lives in Lubbock and beyond. The Texas Tech Physicians Department of Urology is a team of professionals dedicated to providing the best possible care for its patients. Urologists treat three main types of cancer: bladder, prostate, and kidney, by using cutting-edge technology.
It is a novel way to detect prostate cancer using some of the new technology that we have here at Tech, using advanced image-guided biopsies with MRI to directly target these prostate lesions on the MRI in order to more accurately determine whether you have prostate cancer.
Texas Tech physicians also use the latest in robotic surgery.
You could either consider surgery or radiation, and both of them are pretty successful when prostate cancer is detected and treated early. Now, surgery, we have new technology available with our robotic surgery program.
It's considered minimally invasive surgery, meaning that the incision is much smaller. Patients can often go home the same day or the next day for surgeries that typically would involve 3 or 4 days hospital stay.
For the patient, robotic surgery is a very positive experience.
They don't get nervous, they get excited. I do explain to them that it's not like a vacuum cleaner robot that you push a button and it does what it's supposed to do. The robotic platform basically does only what the surgeon tells it to do.
The other option for treatment is radiation.
Using very targeted radiation therapy on the prostate tissue, avoiding any sort of collateral damage to adjacent organs.
Part of the education for patients is to tell them that cancer can have a positive outcome.
It's sometimes, yes, a scary word, but again, not all cancers are created equal. If there is a cancer to have, prostate is definitely one of the ones to have, because it is typically a slow-growing disease that doesn't change dramatically from year to year. And again, usually has a lot of different treatment options and can be easily taken care of.
Dr. Melissa Sanford primarily specializes in urologic care of women.
We deal with female pelvic disorders, so urinary incontinence, pelvic organ prolapse, pelvic pain. I do see some men, and most of those are for reconstructive cases. So urethroplasties after trauma, urinary incontinence after surgery for prostate cancer. Those are just some of the few things that I do. We strongly encourage patients to do things like meditation or exercise to help with the mind-body connection so that we can help get them better. And then we add on other things like medications or even pelvic floor physical therapy to help get them where they can function.
I was in private practice for a number of years. One of the things that I love about being in an academic institution and a medical school is being able to teach residents, but then also being able to take care of all patients regardless of their socioeconomic class.
Following these patients, first when they're diagnosed, then as they go through treatment, and hopefully on the other side, seeing them cancer-free and really giving them hopefully a successful, clean bill of health.
I like when I can fix someone's life and they come back and they say, I can jump on the trampoline with my kids now. I can sneeze in public and not worry about it. I can go to the grocery store and not think about bringing pads.
Being able to train medical students as well as young urologists is something I think I missed in private practice, and that's one of the reasons I'm here.
The TTUHSC Department of Urology, treating patients and educating residents to succeed in either academic or private practice. Community Health Center of Lubbock is dedicated to caring for Lubbock. One way they do that is through their pediatric care. Dr. Leopoldo Cabrera is a pediatric specialist at the CHCL West Medical and Dental Clinic on 19th Street.
Most of the time, at the first set of visit, we encourage our patients, parents, to be active in the prevention of care of their newborns.
Dr. Cabrera has 26 years of experience as a pediatrician in Lubbock. He says the bonding between parent and child is very important.
How the mother holds the patient. Is he really holding the patient right, or is he going to like stress or have anxiety when the baby cries? These are the things have to be careful, because the totality of newborn and childhood development is dependent on this bonding.
Dr. Sean Walker is at the main clinic on 5th Street. He has seen an increase in anxiety and depression among his patients since the COVID pandemic.
A lot of it had to do with isolation. When you're not around friends, you can get depressed and more anxious, and that kind of leads to a downward spiral, and some kids are having suicidal ideation. My job as a pediatrician is to address these issues and get these kids the help that they need. Education, educating the teen, educating the parent, looking for signs and symptoms, and making the parent aware, like, your kid needs help.
I will always offer counseling, and I will stress very strongly that there is no shame in counseling, that it can be very helpful for the child.
We're really big about education here, and so it's fun to get to teach the parents and the kids, and from birth to 18 years old, different stages they're going through, different, even life lessons. I feel like I add in a little bit of counseling sometime. They're asking what's going on in my life and why is this happening to me, or whatever it may be. But it's just fun to watch them grow, and I've really enjoyed getting to know my patients better being here for 3 years now.
I stress strongly a structured lifestyle, eating healthy, staying active, going to bed at the same time, waking up at the same time every day, getting 8 to 10 hours of sleep. And I educate them on, the more structured your life and the more healthy of a lifestyle you live, the better you're going to be able to do in school, at job interviews, with your personal, social relationships.
This is a family affair. That's why I keep telling my staff, treat them, respect them, and help them. And after that, if we have this, with all these values, that core values that the community healthcare Lubbock is, we do respect, and smiling, and all these things are incorporated to this. But the most important is the one who cares about the patient.
Oh, this is a very fun job. I love my job as a pediatrician. I love working with the families. As a primary care physician, I see these kids over the long term. I see them from when they're babies. I see them all the way through high school and see them graduate and live successful lives. It's a wonderful feeling being able to do that and have a profound impact on these families for the rest of their lives.
The Larry Combest Community Health and Wellness Center is a federally qualified health center serving Lubbock and surrounding areas. The center is a nurse-led facility. The care they provide is by family nurse practitioners.
We take care of the whole patient. We try to embody just the humanity that's involved with how patients are trying to stay healthy and happy. We try to incorporate interventions, education that allows patients to live healthier, feel healthier, and just really become the best people they can be. In our center, it's very patient-focused, and we deal with not just the physical, mental, social, but we deal with patients across the lifespan.
We're very patient-centered. All of our policies and procedures and everything is around our patients. The quality of care that we provide to our patients is the thing I'm the most proud of. The Lubbock community has seen the need to take care of all of our citizens with the health care they need, and we're part of that public health component, trying to meet the needs of every citizen. And we're located in East Lubbock because it was an underserved area of the community, and we're located here in the community between the elementary school and the community center for a reason, is to be part of the community and to support it.
A brand new location has just opened up at 416 Frankfort Avenue, serving another part of the community.
It was in a part of town that really hasn't been served by FQHC or by a clinic like ours that kind of sees everybody. So we've had some really good positive feedback from the patients that were on this side of town and was driving to where our clinic was. So now I think we've got a good location to serve a wider part of the community.
The center helps manage many different chronic diseases such as asthma, hypertension, and obesity for all ages. They specialize in diabetes education and give professional help when first diagnosed.
It's scary. I mean, whether you're newly diagnosed or you've been dealing with it for years, it's a very scary and complex disease to manage. And so I love that here we can give them all the resources, all the education and skill sets that they need to have the confidence to manage it on their own. We focus on making positive lifestyle changes, whether it be in our weight loss classes that we offer or our cooking classes. We really try to focus on making those positive lifestyle changes that are lasting.
In our facility, we have a van driver who will actually, you make an appointment. When you make your appointment, you tell them you need transportation, and they can have this guy come out and he'll pick you up. Steve's a really nice guy. He can drop you off, go pick up somebody else, takes people home, does whatever he can to get you to your appointment on time.
Being a nurse and working here at the center has been a blessing and is much of a therapy for many of us. And we love what we do.
To actually be in an environment where we work to keep them well and healthy has been a dream come true.
It's a dream job, absolutely. I love that part of my job is actually monitoring, tracking their progress and kind of making sure that they're not only following the recommendations that we're giving, but they're feeling confident about the changes that they're making.
From the time you call, how can we help you pay for it? How can we assist you in getting to the places you need to be, and we can't help find everything, but we can help you understand the program and navigate you through as best we can.
Healthy lifestyles begin with becoming an educated consumer. Thank you for watching this episode of Look Around Lubbock, and I hope that you've enjoyed learning about new state-of-the-art medical practices available in the West Texas region. Join me, Kirk Kaiser, every Saturday and Sunday afternoon as we continue to feature medical providers dedicated to promoting healthy living. Watch right here on Fox 34 News Now. Discover your path to a healthier lifestyle.